your options. So if your rate's in the fours, or if you've refied in the last year, remember this, 30-year fixed rates in the threes. Call Private Plus Mortgage today, 888-220-6200. Refi or purchase, 888-220-6200. Private Plus Mortgage.
Private Bank of Buckhead, 3 Piedmont Center, Atlanta, Georgia, 30305. Actual terms may vary. Member FDIC, equal housing lender, and MLS number 758-195. Call toll free for credit costs and terms.
About the coolness factor of the liver. So many elements.
The music.
I'll do what's up.
Ladies and gentlemen, you are now listening to the beginning of a new way of living. It's Younger Life.
Okay. All right, sounds good. Okay. Okay.
Good morning and welcome to another great edition of Younger Life. I'm Rick Federici.
I'm Mary Anthony.
It is so great to see you again today. Are you feeling
Thanks, it's a good
positive?
day. That's right. That's right.
I feel absolutely great. It's so great to be here. Thanks for another stellar show yesterday. Got some great input. And today I am so beyond excited because you and I chat about some of these fine guests that we have here on Younger Life. And one of the things I want to throw out there, we're going to connect with an article that you turned me on to, that the doctor that we're going to speak with today in a matter of moments is up on YoungerLife.org.
That's right.
So let's chat about our guest today there, if you wouldn't mind.
We are going to be speaking with Dr. Ismaili from LaPorte Hospital, and he is a gastro doctor that specializes in the liver. So, it really is amazing. He has a fabulous article on YoungerLife.org right now about diseases that strike the liver. And it really is incredible at the effect so many things have on the liver, and the liver affects so many things in the body, so it's pretty fascinating. I'm really looking forward to talking to him.
And I was going to say, one of the things I want to throw out there, this is near and dear to my heart because I started understanding the liver, and God rest my father's soul. My father had several heart attacks, and we've talked about our health in general as individuals, as husbands and wives and moms and dads, and all of us here in the audience, grandparents, younger people to the wisest of years. But I didn't realize how intricate, quite honestly, till later in my life, that the liver actually plays in our lives until my father died from complications to what was a surgery, and his liver basically failed.
Wow.
It's sad, but quite honestly, it's something that it hits you right in the face.
It's eye-opening.
It is.
Just like when we keep learning, when we had Heart Month, and there's just so many things that we don't know, in our everyday life that we just take for granted. And so when we find out these little details and just what we could do to increase our own health and increase our own chances of keeping our organs healthy. So I really look forward to talking to him, and I would encourage anyone that has questions, please definitely call us. We're going to have the doctor with us, which is, a great resource. I mean, it's just not something you get every day. You can't just call his office and get to ask him a question. In this case, you can. So please take advantage of that.
Well, I'm digging it, and he's a real great guy, obviously a wonderful writer. And I, you go right to the article on YoungerLife.org, and you see, you cannot live without that liver. You know what I'm saying? You just can't.
Right.
So that, unto itself. And then there's a lot of questions too, from a guy or a gal standpoint that you may kind of want to scope out and feel it out. But I would really love during this show, during this segment, for us to kind of really dissect the liver, find out a little bit about what this doctor does. And I also, on the spin, had a real cool text from a young one out there listening that is trying to get into this field saying, how did this doctor get into what he's doing right now?
That's a great point.
And I love that because a lot of us that are in our fields, we try to pass that on to the next generation or to someone that may be wanting to change fields. So it's a whole other spin,
Yeah, absolutely.
on what's going on.
Good. I know he's going to be joining us Skype. Let's go ahead and can we see if he's there?
Yeah, let's absolutely
Okay,
see and
let's
connect
see.
with our doctor here on Younger Life. Here, of course, our doctor is with us. Doctor, are you with us on Younger Life?
Yes, good morning. I'm here.
Good morning. Thank you so much for joining us and taking some time. It's an honor to have you here on Younger Life. And there's a lot of things we want to chat about, but I think one of the main things there, we like to find out a little bit about you.
Yes.
And we know that you've got a great background. You're a very, very intelligent man. Can you tell us a little bit about yourself, sir? A little bit about you.
Sure, Rick. Good morning to everyone. My name is Ali Asmali. I am a gastroenterologist. So what that means is a gastroenterologist is a specialist in diseases of the digestive tract, which includes 7 organs. So you're talking about the esophagus, the stomach, the small intestine, the large intestine, the liver, the gallbladder, and the pancreas. And the track to becoming a specialist in digestive diseases includes, well, first the undergraduate work includes going to college, 4 years of college, then 4 years of medical school. After medical school, you have to specialize in internal medicine. So that's 3 years of residency. And then after that, you do a fellowship in gastroenterology, which is another 3 years.
Wow.
And then what I did was I specialized in liver diseases and liver transplantation. So that's transplant hepatology, another year.
My goodness.
Wow. It's a
that's
lot
incredible.
of school, a lot of knowledge, a lot of education there.
I'm
Absolutely.
curious to know, doctor, when you began, your pre-med, did you already have an idea that this is what you wanted, or is this kind of just as you went along, did you just become fascinated by the liver?
Yeah, usually the way it works is during your early years of your training in medical school, you take a liking to whatever mentor you might have. And I was lucky enough to work with a group of really brilliant gastroenterologists. So I did some research with them, and that's where I was pointed.
That's great. Wow.
Can I ask too, and I would like to throw this out there for our viewing and our audience that may be listening on the radio today too, Doctor. The liver does have a ton of functions. I've only learned and come to appreciate how truly integral the liver is for all of us, to live. Can you chat about the liver and its many functions? I know that's just kind of, I'm throwing that out there, but that's how you kind of start out your article on YoungerLife.org. And I would love for you to just chat about the liver. And then, if you want to delve into some of its functions, we would love to hear your input on that, please.
Sure. The liver is a large organ, one of the larger organs in our body. It's about the size of a football. It's on your right side of your abdomen, right under the ribs. And it has many functions, like you mentioned. It is a vital organ, one of the few vital organs we have. When you think of vital organs, you think of heart, the lungs, and kidneys. The important thing to know about the liver is also a vital organ. But the difference between the liver and, say, the kidney is, for the kidney, when the kidneys fail, you have dialysis. There is no equivalent for the liver. So if the liver fails, the options include liver transplantation or death.
Wow.
So, going back to the functions, one of the major functions of the liver is to clean the blood. So whenever we take anything in our body, when we ingest it, the ingested material gets absorbed through the blood vessels, and then all these blood vessels from the bowels coalesce into one large blood vessel called the portal vein that comes into the liver, and then there the the ingredients get digested and kind of broken down into non-toxic material. So this is one of the important functions, to clear the blood from toxins. The other is to make proteins that help you build your muscle mass, build antibodies that protect you against infections. And in other things, this is a source of energy. Extra energy can be stored in the liver.
Wow.
So when you go into starvation mode, you can use that as a source of energy.
Wow, I didn't know that's a function I've never even heard of from the liver itself. I'm familiar with the cleaning aspect that it does.
That's
and
what I think of all the
yeah, and I
time.
think obviously that's super important. I just didn't realize that it can store energy as well. I mean, my
Right.
goodness, wow. I'm curious to know then, doctor. I was surprised to read in the article that 1 in 10 Americans suffer some sort of liver disease. Some form of. So I mean, there are so many different things that affect the liver. I'm curious to know what would be one of the earliest warning signs that a person needs to call their physician if they're having any issues that could be that they could be concerned could be related to the liver.
One of the early signs is, well, I wouldn't say it's early, but one of the signs that is visible is yellowing of the skin, excessive itching, which kind of go together,
Wow.
I didn't know that.
confusion.
Yeah.
I'm sorry.
I was going to
yeah.
say, I didn't realize that at all. I've never heard of the itching. The yellowing, I've heard that through the years, but the itching is a result of what, doctor? Is that because the skin? Can you explain that to the audience? Because these symptoms, these signs may help someone listening or viewing in the audience today,
Sure.
To potentially find out something that they need to know.
Sure. What happens is the liver breaks down bilirubin, which is used in bile production. And if the liver is scarred or somehow not functioning well, that can't be cleared from the blood. So then it gets deposited into the skin where you see the yellowness, and also it causes itching.
Wow. Okay.
Can I just ask this question? Because it is something that is up on YoungerLife.org under your great article, what you kind of need to know. You got to click on that tab. That tab up on top is what tab on that?
If you go to the Get Knowledge tab, that's
Get
the
Knowledge
article is
tab.
the very first
It's really
one.
cool. But why should we even, I hate to be this way, but I'm going to ask the question that's up on this article, but why should we care about liver disease? Is it that big? Is liver disease, that huge out there, doctor, among the public, in terms of being up there in the top 10 or whatever it may be of diseases?
It is. It's 1 in 10 Americans are afflicted with some sort of liver disease. And that amounts to about 30 million people.
Right. Wow.
So there are people amongst us who have liver disease and don't know about it. The lucky thing about the liver is that it's very resilient. So it can grow back, it can regenerate itself. So if you detect the disease early and stop the offending agent, you can reverse the liver disease.
Wow.
Doctor,
That is
we've
nice.
got a phone call, 219-861-1632, Younger Life, Younger Life Live, of course, 219-861-1632. Caller, you're on the air with the doctor, Rick and Mary. What can we do for you? Thanks for calling.
Hey, gang. Quick question. I think you just answered it. I heard that the liver can actually regenerate itself, and that just seems like really odd to me. Can you talk more about that? Because I have a friend who actually had a partial liver removal, and I just thought that the story was really strange that they could just rebuild a liver based off of what they had.
Thanks for the call. Doctor, your answer on that one, please?
Yes, the liver has this strange ability to regenerate itself. And, we can take advantage of it. And that's why there is, in certain centers, they offer living donor liver transplantation, meaning that if the donor is a match, they take a healthy individual and they have to do excessive testing and make sure that there is no scarring in the donor's liver. And then they can remove half of the liver and donate it to another person. and the liver will grow back and heal itself.
I have a couple questions, doctor. So, is the liver the only organ that actually does that then, right? And will
Pretty
regenerate
much.
itself? Okay. And when you said they can remove up to half of a liver, looking at your diagram of the liver, I thought was really cool. I didn't realize that the liver had a right lobe as well as a left lobe. Does it matter where a portion is removed from?
It does, based on the technicalities and how they can rearrange the blood vessels to it, so the donor vessel can also get a proper vasculature.
Doctor, what liver diseases should I be concerned with? I'm a 49-year-old guy. Think I'm in pretty decent health. Do have high cholesterol, and I do take a small amount of, I guess it would be high blood pressure medication once a day, a 0.5, nothing big, but I'm just concerned because as I read your article, I'm looking at that exact, I'm in that exact, you're in the exact stat, Ricky Federici, for that 49 to 54, where it affects people. What diseases should I be concerned with at this point in my life for me personally?
Well, there are two diseases that are very common. One that you mentioned that I believe is going to be our next epidemic is non-alcoholic fatty liver disease. Statistics have come out then that 1 in 4 Americans are affected with non-alcoholic fatty liver disease.
Wow.
And this is a funny name because it involves fat storage into the liver in people who are not consuming large amounts of alcohol. And the reason they named it this way is because alcohol consumption over the recommended amounts can cause liver to store fat inside it. But people who have non-alcoholic fatty liver disease obviously are getting the fat deposition into the liver from other sources.
Mm-hmm.
Can you as a doctor, when you're scoping this out, if you don't mind asking, because there's a lot of us that don't partake, that we may have an occasional cocktail or whatever, just, we're not heavy drinkers. We just, every once in a while, once a month or whatever. But is there a test or is there something that you do with your team doctor that you could kind of find out if this is happening? Is there a test, I guess, would be the easiest question to ask, that you could find out?
The early signs of it is elevation of liver enzymes.
Okay. Is that a blood test then?
That is a blood test, yes.
Okay.
So what happens is the extra fat into the liver causes inflammation, and that inflammation then causes the liver cells to leak the enzymes that hold inside them normally into the blood, and then you could test for that. So that's elevation of liver enzymes, but that is a very non-specific test.
Okay.
It could be elevated for many, many different reasons.
Okay. I know. I'm sorry.
Go
Go
ahead.
ahead. No, please go ahead.
So the next step from that is usually you do an ultrasound of the liver, and that is to look for any blockages in the liver, liver pipelines, if you will, and to see if there is from a physical blockage that causing the enzymes to leak into the blood. And if you rule that out, then you can sometimes see fat deposition in the liver parenchyma, what they call, in the liver cells.
Okay.
And then the next step would be a liver biopsy to actually see how much fat is deposited into the liver and how much scarring there is.
Okay. Okay. I have a question about the when you're talking about alcohol consumption for this non-alcoholic fatty liver, I wanted to make sure, what are you basing that on the recommendation of no more than a couple drinks a week for the average person? Is that
the number that's out there is different for men and women. For men is 2 drinks per day.
per day?
And that is
Okay.
that is 1 mixed drink, 1 glass of wine, or 1 glass of beer. And for women it's 1 drink. But I give you some caution with that. There are some underlying genetic factors where some people can tolerate more alcohol, some people can tolerate less. That's just the average number that has been put out there by experts.
Okay. And can I ask how that differs then from, I all my life heard of too much alcohol affecting the liver, how the non-alcoholic fatty liver, how that differs from the person that consumes too much alcohol? How is that disease different?
That disease does not come from alcohol consumption,
Right.
but the end result is fat deposition into the liver, which then in turn causes inflammation of the liver. And how do you get the fat deposit into the liver if you're not drinking alcohol? Well, the common things include what we call metabolic syndrome. Being overweight is number one cause, and especially what we call truncal obesity, meaning that if you wear your extra weight around your belly. The second thing would be elevated blood pressure, elevated blood sugars, and elevated lipids.
Okay. All right. Can I ask about another kind of liver disease? You often hear hepatitis related to the liver, and I know there's hepatitis A, B, and C, and I'm not really exactly sure of the differences in them. Could you tell me a little bit about that? Talk a little bit about how that relates to the liver?
Sure. Hepatitis in general means inflammation of the liver.
Okay.
And it could be from many causes. It could be from alcohol, it could be from drugs. But what you're referring to in specific is viral hepatitis, which means a viral infection of the liver, which in turn then causes inflammation of the liver. And the most common viral hepatitis includes hepatitis A, hepatitis B, and hepatitis C. Hepatitis A you don't often hear about because it doesn't become a chronic illness. It's a self-limiting viral infection that is actually a foodborne illness. You can get it from infected food.
Okay.
And it usually runs its course. It's like any other viral illness. You can become jaundice, yellowing of the skin or the white of the eye, fatigue, and diarrhea. And usually it resolves in a matter of a few days to a week. In very, very rare occasions, it can progress to liver failure.
Okay, I have a question about this directly Hep A. I know I have children, and they actually now get a Hep A vaccine, which with when my oldest was little, or they didn't. And so is this to prevent, because it can do, you said it kind of runs its course typically. So I'm curious as to why we do the Hep A vaccines now in the children. Is it because it can eventually, in very rare cases, lead to liver failure, like you just said? Or
it can.
Is that why they do them now? Is that just a preventative thing, or is there a reason that they
Correct. That's the reason. If they have any other compromise to their liver, this can put them on, over the edge and go into liver failure.
Okay.
And sometimes there are some silent diseases of the liver that you don't know about, and so you don't want to put yourself at risk.
I see. Okay. Well, that makes sense. I was curious why that wasn't a standard vaccine years, like I said, when my oldest was littler, and then now is a recommended vaccine. So, okay. That's about Hep A, and then you started to say Hep B. I'm sorry.
Yeah, hepatitis B is mostly a sexually transmitted disease. And the major difference between hepatitis A and hepatitis B is after the acute illness, hepatitis B can go dormant and live in your liver for the rest of your life. And that is the chronic phase of the disease. During that phase, it can cause inflammation slowly and then lay down scar tissue and lead to cirrhosis and even liver cancer.
Wow. Is there a vaccine to prevent that?
There is. Luckily, there is a vaccine for hepatitis B, and that is one of the recommended ones that didn't used to be recommended years ago, but now it is.
Okay.
Can I ask a question, Doc? The thing that we wanted to talk about too, and we just got a couple text messages. People are wondering what, and if you could explain, you being the expert here on Younger Life, cirrhosis. You hear that word a lot, cirrhosis of the liver. Can you kind of chat about that a little bit, or explain how that all comes about, and maybe just to give us a little insight from your perspective, your knowledge, if you wouldn't mind?
Sure. Cirrhosis is the end result of all these different diseases of the liver. So we mentioned that different things can cause insult to the liver and cause inflammation. And then the next step from that, after inflammation goes on for a while, you lay down scar tissue. That is called fibrosis.
Okay.
So fibrosis is equivalent to any scar tissue which can or cannot go back to healthy liver. Once fibrosis progresses to cirrhosis, that means that enough scarred dead tissue is laid down in the liver that it can't go back. That resiliency of the liver that we talked about, the ability of the liver to regenerate itself has a limit. Once the cirrhosis sets down, it doesn't go back.
Okay.
All right, Doc, we're going to take another call. Younger Life on the air. Mary Anthony, Rick Federici. This is awesome. 219-861-1632, a breath of fresh air and knowledge. Caller, you're on with the doctor and Rick and Mary. What's your question today? Thanks for calling.
Good morning, Rick. Dave here. I had a question. Is there any particular food that we could add to our diet, maybe even on a daily basis, that really helps strengthen the liver's functions and so forth? I heard once potassium is really good, helps the liver to regenerate and so forth. But is there any particular food that are, maybe even that we should totally avoid? And I'm not talking just alcohol, but a food that we should totally avoid that's really harsh on the liver? Or is there a particular food or food type that we should eat daily to help with the liver's health? Thank you.
Good question. Thank you, Doctor. What's your thought on that, please?
So you can break this question to two different questions. One is recommendation for a healthy individual to prevent liver disease. And there is really nothing that is truly a liver-friendly food. What we recommend is a balanced, healthy diet that is good for your heart, good for your lipid profile. A lot of fruits and vegetables, and trying to cut down on simple carbohydrates like sugars and starch, and cutting back on fat.
Okay.
So that's a general recommendation for everyone, and it keeps your liver healthy as well.
Okay.
Then the next question would come to people who already have cirrhosis.
Mm-hmm.
Then in those people, usually we recommend cutting the sodium down.
Okay.
Because then the body can't handle that, and then it can go into volume overload, where the people who have cirrhosis can develop ascites, where there's a lot of fluid building into the abdomen.
Okay. That's good. The sodium thing. That was going to be one of my next questions. Is once someone already gets to the point of cirrhosis, that was what I was curious about. Is what can we do from there? So I mean, in reading the article, obviously trying to keep a well balanced diet, keep your alcohol intake at a recommended or less level,
Mm-hmm.
and
it's hard for a lot of people.
It is. I mean, it certainly is. But everything we've talked about when it comes to serious health issues, I mean, that is humongously detrimental to your health.
Oh, I agree. I'm with you. I'm just saying there's a lot of people listening, and these
true.
are great questions coming in.
It is, and it is fascinating to me. That's what I had about once you got to cirrhosis, kind of where you can go from there. I mean, is it hopeless? I mean, once you start having problems with the liver, it seems like it kind of goes to everything. I mean, every other organ then suffers. It sounds like, It's why it's so important to take care of it. I love the question about what can we do, what can we eat, to help it. I mean,
That
but
is
it just
great.
sounds like
Are
a
there
well-balanced.
vitamins? Is there,
Yes, I mean, it's just right because it's very scary when you realize how much it affects all of your vital organs. So.
I guess too,
it
the
would
other
be-
thing I wanted to ask you, doctor, is, obviously my father had a couple of heart attacks. He did rehab. And in that span of 13 years where he had the 2 heart attacks, he did the rehab properly and all that great stuff. Unfortunately, on the back part of the second one, when he got through it, it was totally cool. He got through the surgery, but the liver basically shut down. So at that point, that's when I truly, and this goes back now 15 years he's been gone this June for us. And it's like every day you think about this, what could we have done as a family? But the liver, when it shuts down, it's basically just saying enough's enough. Is that basically what transpired there? And I know you don't know the case exactly, but I'm just in a general statement. Is that basically what transpired? It was like, it's done, it's over with, finito.
Well, in general, probably what happens in that situation is after a heart attack, the liver requires the vasculature and perfusion of blood to get nutrients. And when you have a heart attack, you basically don't get enough blood to your liver, and the liver can get damaged from it. And usually it recovers from it. But if there is underlying liver disease, and usually people who have heart disease have the risk factors for this non-alcoholic liver disease. So there must have been some sort of scar tissue formed. And remember, this is a silent disease. You don't go around recognizing that until it's usually too late.
That's why it's so scary. I mean,
Right.
it really is. I'm curious to know, doctor, at what point is a transplant determined? When does it, when would you say, at this point, I feel that our only choice is to get, on a transplant list? At what point is that for someone?
Obviously, everyone who gets a liver transplant already has cirrhosis, but not everyone who has cirrhosis gets a liver transplant, and they don't really need it. Most people who have cirrhosis still have preserved function of the liver. But once you start losing the function of the liver, that is the time you would need to replace the liver with a functioning liver.
I see.
And that's what liver transplantation is. So in people who get kidney transplant, there's a different system. There's a wait list and how long they've been on wait list.
Right.
That determines when they get the kidney transplant. Whereas in liver transplant, it is given based on need. So there is a complex formula that takes certain byproducts that normally gets cleared by the liver and see how long it builds up in the body.
Mm-hmm.
And they put that into a mathematical formula that spits out a number. And based on that, it determines your need for liver transplantation.
Okay, great. We have another caller, doctor, if that's okay. And I want to shoot our number out one more time. It's 219-861-1632. If anyone else has a question for Dr. Ismaili, go ahead, caller.
Yes, hello. I'm wondering, is the doctor affiliated with LaPorte Hospital?
Doctor, are you affiliated with LaPorte Hospital from the caller?
Yes, I am.
How does one get in touch with you then?
Doctor, can you please throw out a number? Caller would like to know how they can get in touch with you, if that's okay, or to your office.
Sure, it's 219-324-0875.
Thank you, caller. Anything else?
Thank you very much, doctor.
Okay.
Sure.
That's a good question, doctor. I'm curious, do you have to be referred by your own family doctor, or could someone that's experiencing issues or just afraid that maybe they have some of these symptoms, are they able to call your office on their own?
They can. That's the matter of technicality, the insurance coverage. Some insurances require you to be referred by your primary care physician, but that can always be worked out. If they have a question, the patients can always call our front desk and they can work it out for them.
Great. Where is your office located?
Across the street from the hospital in the Heart and Vascular Center.
Oh, you are 901 Lincoln Way.
We know where that's at.
We
We're
were
always
there.
there.
Yeah,
Woo!
yes, that's great. Okay, so that's where you're located.
He's going to see these two crazy kids show up and go, Doctor, what's up? It's us.
It's such good information. And so important for people to realize again what part the liver plays. So I know this is colorectal cancer awareness month. Does the do you treat only liver conditions on yourself, or do you treat any of them? You just kind of specialize in the liver.
No, I'm a gastroenterologist by
Right.
training, so I handle all the diseases of the colon, the small intestine. So yes, colonoscopies is also one of the things that I do.
Okay.
Colonoscopies, for the guys that are edging up on what age their doctor, for the men in our audience, should they be having that? And the second part of that question would be, do women get colonoscopies, just to kind of educate our audience as well on all sides?
Yes, going back to the numbers and the statistics, colon cancer affects both men and women. Basically, anyone who has a colon, but both men and women have colon, so they are at risk of getting colon cancer. And the risk is 1 in 19 people.
Wow.
So every year, 50,000 Americans die from colon cancer. It is the number 2 cause of cancer death in the United States.
Wow. I didn't realize that.
A lot of it is preventable.
Okay.
And the recommendations are to start a colonoscopy at the age of 50. And remember, these are people who have no symptoms. These are healthy individuals who have no bowel issues. Up to 30% of those people at the age of 50 have colon polyps. A colon polyp is a growth inside of the colon, and a lot of times it's benign, but some subset of these polyps can grow into tumors. So colonoscopy is designed to find these polyps before they become cancer and take them out, so they never get a chance to get big and turn into cancer.
Okay.
For those folks, can you do some type of a self kind of scope, like let's say, a person out there saying, well, would you be able to recognize what a polyp looks like, doctor? Like someone, just a normal, individual, like say myself, I wanted to do a self-exam, like, women do self-breast exams or whatever, and they, specifically feel around their breast area, so on and so forth. In a situation like that, where someone's like, okay, I want to see, is there some type of a procedure you can do, or not really? It's got to be done by you guys.
Not really, because it's deep inside of you. It's in your large intestine, which, the scope is 6 feet.
Wow.
So it goes all the way to where your small intestine and large intestine join.
Wow.
So it's a test that is done under sedation and after you do a bowel cleanse.
Okay.
So it's not something that you could do at home.
Right.
Okay.
I know you said recommended beginning at age 50 if you have no other risk factors. Is that like a once a year kind of thing? Then that should be.
It's not. The first test determines when the next one is going to be.
Oh, okay.
So if you have a colonoscopy at the age of 50 and you're one of the lucky people who have no polyps, then you're good for 10 years. You don't need another test for 10 years. So it's not very frequent. If, on the other hand, you have 1 or 2 polyps, they will be taken out during the same procedure. They go to the pathology lab, they look at it under a microscope, and then they tell your doctor whether these polyps have the potential to come back. Based on that, usually the interval is cut to 5 years, sometimes even 3 years, depending on the number and the size of the polyps. The idea is people who have polyps tend to get them again, so you stay on this screening protocol throughout your life and take them out before they become problematic.
I see. That makes sense.
Is that something, just looking at a text message from someone talking about the polyps, is that something you inherit as a, throughout your family? So like, let's just say my father had polyps, or my brothers, or just, in general, someone in your family, would that mean that you are more susceptible to get that, doctor? Or is it just everybody's individual on this one? I'm just kind of curious.
That is correct. If you have a family history, you're more likely to have polyps, but not all of it is determined by family history. If you don't have anyone in your family, you could still have polyps. You could still get colon cancer. Only about 10 to 15% of colon cancers are hereditary.
Wow. Okay. Definitely good information. And
someone just asked too, and I want to throw this out there, Mary, while the doctor's with us just for a moment. How long is the procedure, and is it painful? That's a great question.
It is a great
It's just a
question.
simple, but it is a great question. Doctor, what's your thought on that?
The procedure is painless because it's done with sedation, so you're really asleep for the duration of the procedure. The procedure itself takes about half an hour, but that day, because you get sedation, you would go to the recovery room to wake up from the sedation. So it takes about 3 hours out of your day. The rest of the day, you should not drive. You should not make any important decisions. That's because of the lingering anesthesia. By the next day, you're back to normal, and there is really no pain. The only extent of discomfort after waking up from the sedation is you would be gassy because we have to blow air in your colon to get around the bends of your colon and examine every nooks and crevice in your colon. So it is like having bad gas. That's the extent of discomfort after the procedure. The worst part that people hate is the bowel cleanse the day before. But even that, there have been significant improvements in the medicine that we use. It's not as bad as before, and it cleans you out. That is necessary. The cleaner you get your colon before the test, the more accurate your test is.
Is that like that's a drink? Is that?
It is a drink. Yes,
Okay.
it's a powder or a liquid you mix with water or some sort of liquid and drink it.
Okay. I thought so. I've heard,
I've heard things too
that's
through the
yeah,
years.
I was just curious if.
But the doc is reassuring that it's only getting better. So for us guys
Well,
that
and
are going to go
certainly,
through it, I'm going through it this year.
Well, I think it's important, and I think it's important to definitely shine a light on it. I mean, we're talking, that's definitely a big deal. 1 in 19 people, that's huge. And I do know, obviously the sooner any cancer is detected and taken care of, it just improves your odds of being able to beat it. So I think it's definitely important to talk about and, really bring awareness to the things that we can do. And this is might be a different type of screening, but it's just another screening. Just like I know mammograms are not the most pleasant thing either, but it's still an important screening to have done. So I think this just is another one on the list, So far the heart cart's the easiest screening I know. That was nice. So I appreciate it. I think, Doctor, you're so full of great information, and this is so important. Again, can we give your phone number out one more time if anyone needs to contact you?
Sure, it's 219-324-0875.
Fantastic.
Thank you so much, Doctor. Any final thoughts from your side? And I so appreciate your time this morning here on Younger Life. You could save a life just with what you've chatted about in the last 40 minutes. Anything you want to throw out there to folks that, whether it's from symptoms or signs or just thoughts to that person that's edging up on 50 and really getting yourself tested? What's your thoughts, Doctor?
Sure. Two things. One, going back to colon cancer, that my recommendation is to stick with the screening and try to prevent colon cancer before it becomes cancer, because unfortunately we don't have good treatments for cancer. So your best bet is to stop it before it even becomes cancer. And remember, you won't have, the majority of people don't have any symptoms. Now, the symptoms that might force you to get a colonoscopy, if you have rectal bleeding, if you have any blood mixed in your stool, any change in your bowel habits, any abdominal pain, any new onset of constipation and discomfort. So those are the symptoms to watch out for, but I encourage you not to wait for those symptoms. If you meet the age criteria, you should really get your colonoscopies even if you are completely healthy, because oftentimes when people wait for symptoms, that means that polyp that was small has gotten big enough to cause an obstruction in your colon. And by then, it usually requires surgery, so it's too late. And the other thing that I wanted to mention that we left out, going back to liver disease, is the third kind of hepatitis C, which is the biggest one in the United States. It is now about 3 million people in the United States have hepatitis C, and it is the #1 cause of getting liver transplantation.
Really?
Hepatitis C, just like any other viral hepatitis, starts as an acute phase, and it is it's a bloodborne illness. It usually gets transmitted to you by being exposed to someone else's blood who is infected with it. The common ways of getting it is sharing needles through intravenous drug use, or sharing straws when they inhale drugs, or careless tattoos. Those three main ways of transmission. But other people who don't have drug history, if they had a blood transfusion before 1992, when we didn't know about this virus and we didn't test the blood bank for it, that's another risk factor. And in fact, the Center for Disease Control has put out a recommendation for the baby boomers, anyone between, with birth dates between 1945 to 1965, should get a one-time testing for hepatitis C. It's a blood test. It shows you whether you're infected or not. And it's a really easy test. The good news is now there are really good medications available for it. It used to be a toxic drug we had to use, and it was an injection drug called interferon. And even that, it didn't have really good results. It was about 50% cure rate. Now the cure rates are in the high 90s, 98 to 99% chance of curing hepatitis C, which could be a deadly disease.
219-861-1632 here on Younger Life. Caller, you are on with the doctor. Please go ahead with your question.
Yeah, quick question. I heard a lot about getting the colon cleansing, and I didn't know if that was a good idea or not. I'll listen. Thanks.
Sure. What you're referring to is one of the fads that have been out there for quite some years, doing a colon cleanse. There's really no scientific data to support it. What we have in our colon is basically an ecosystem. You have good bacteria that live there that help with our digestion. And sometimes doing those colon cleanses washes out that good bacteria and actually changes your bowel pattern. So it's not something that we routinely recommend for people who don't have symptoms, or sometimes even if you have some changes in your bowel habits, people reach out for that kind of treatment. But it really is not something that we recommend doing.
Would you say then, doctor, if someone is experiencing issues and rather than buying an over-the-counter thing, call your office instead or call your own family doctor, what would be the best?
Usually that is the best thing to do. I mean, there are things out there like probiotics. Those are healthy things. You could try that and see. But you don't want to ignore warning signs. So I would suggest if you have acute changes in your bowel habits, or certainly if you see blood in your stools, those are things to call your doctor first. And oftentimes your primary care doctor is a good source to answer most of your questions. And if they need help, they can always find us.
Okay. I love that you brought up the probiotics. I'm curious, you always hear, I have children, so I'm always hearing other moms say, oh, you should give your children probiotics every day. Is that something that I should be giving them as supplement, or is that something that we should deal with maybe only if they are having issues? I mean, it's such a broad range. You see, Flintstones,
you see those vitamins,
yeah,
the gummy ones.
You see them,
there's
the
tons.
gummy ones.
Oh yeah,
right. Is
absolutely.
that something that I should consider for my children, even if they aren't really having any issues? Is that still healthy for them?
I don't think you necessarily, it wouldn't hurt, but I don't think you necessarily need them. So it only would hurt your wallet, your pocketbook. So I don't recommend it just for everyone. There are certain uses for it that are proven scientifically. And, when you consult with your physician, they can use it for those indications. But to go out and just buy it for everyone, I think, and a lot of times would be just a waste of your money.
Okay. I appreciate that.
Doctor, you've been absolutely phenomenal. Your knowledge is excellent. We would love to have you back on the air. We so appreciate your time and what you do for our community. And once again, we'd like to thank you and all the folks that surround your great team that, keep helping save lives around the area and keeping us healthy. So thank you so much for your time today on Younger Life. We do appreciate it.
Thank you for having me on your program.
Absolutely.
Have a good day.
Thank you.
Take
All right,
care.
Younger Life. Wow, that to me is great calls today.
I know. Oh, yeah. And, I love that. I love when people get involved, too. You and I always chat a little before the show, trying to brainstorm things that we want to make sure we don't forget to ask for our own selves, but as well as people listening. So it helps out so much when they call in with the questions. I think that, they were all such good questions. I love that the caller asked about the over-the-counter stuff, only because, you do see that and you often think, oh man, is that a way I can better take care of myself? You know what I mean? So I love the information from the doctor, and it's nice to hear a doctor say, don't waste your money on some of it.
I love it.
You know what I mean? I think
it.
that's fantastic. It is such a serious topic, though, and one we're going to try to have a couple more times this month, being that it is Colorectal Cancer Awareness Month. I know tomorrow we have Dr. Tatel on.
And Dr. Tatel will be another great one because I love it. Line up your questions.
That's it. He's another gastro doctor, and it will be it's just so interesting. And the more we learn about our own bodies, the way that we learn that things work, simple things we can do to just improve our overall health and lives in general. So. Such good information. He's just so fascinating. And again, if somebody has a chance, pull up YoungerLife.org, under the Get Knowledge tab.
I love that.
He has
man.
his first
so
article.
Great.
His article is the first one. It's a very good article.
Love
it covers
it.
a lot of the things we talked about today. There's so many things I learned, but I didn't realize hepatitis C was so prevalent. I would imagine that would be the least of all of them, because I feel like now in our day and age, I'm shocked that so many people would be doing drugs.
Well, wait, you gotta.
I know
you
it
gotta
happens,
them,
but the needle, the
but you put them in that.
sharing
But you put that in that situation where they're itching for a fix and they're an addict.
I know, but
and they're like,
you
give me the needle, and they're using it or whatever. But the one that freaked me out, kind of to layer that.
Yeah.
I didn't understand where the problem comes in if someone's using a straw.
Yeah, I think when he said snort drugs, I'm assuming just because your nose is so, if I know I have a couple children that get bloody noses very easily, so I'm sure.
Oh, you're talking
what
about
I mean?
the blood aspect.
And so
okay.
when he said it's bloodborne, when he first said straw, that threw me too, till he said to snort. I think that's probably
I get it.
what he's meaning, the nose. You know what I mean? That's how I would tie it in. But it's sad and staggering to me that people would be willing to, drugs are bad enough, but you're talking, it never goes away. And he said that's the number one reason that people have to have liver transplants. That's crazy.
Well, Lee
Very
just
scary.
asked too, tomorrow on the show, can you guys please ask about diverticulitis?
Oh, great question. I had a coworker before
that, and that's a
struggled
big
that
word.
chronically. I'm going to write that down just so we don't forget to.
Please. Lee from New Carlisle, diverticulitis. We can ask the doc. Now, does that relate to that? I'm not being
it is
stupid.
Related.
Okay.
It is. I had a coworker that had some issues with that, reoccurring.
Is that where you can't eat seeds? Is that what that is?
Does. I know that was a trigger. I'm not sure that you can't, but I'd rather the doctor explain, because I don't know enough about it. I just know I had a coworker.
Let's let the doctor explain.
I just know I at one time had a coworker that struggled with that. So, and that was really the first time I had actually learned about it. So,
well, and I'll tell you too, healthy recipes, like you said too, that article that the doc put, up on Younger Life is stellar.
Oh,
YoungerLife.org. Well, we're coming to a wraps on
Yes.
this segment of Younger Life Live, and we so appreciate all of you that hang out with us Monday through Friday, 9 to 10 Central. I learn something new every day.
I do too.
I thoroughly enjoyed the show. Thanks to our tech crew on both sides. And thanks to Brendan and Steve and Sanders on our side. And we so appreciate that. I'm Rick Federici.
I'm Mary Anthony. We'll be back tomorrow.
Yeah, we will. We'll see you then.
Sounds good. Thank you.
Thank you.
AM 1420, WIMS, Michigan City, a Girard Media Company station.
CBS News. This is Pam Coulter at the White House, where President Obama is expected to announce D.C. Appeals Court Chief Judge Merrick Garland is his choice to fill the vacancy on the Supreme Court. The 63-year-old Garland, respected by both liberals and conservatives, was considered once before in 2010. He's a former law clerk for Justice William Brennan, a former federal prosecutor who oversaw the Unabomber and Oklahoma City bombing cases, and he's Jewish, which would add more diversity to the High Court. Republicans have vowed to oppose any nominee, but the president has said it's a chance to rise above the venom and rancor in Washington.
It's the one court where we would expect elected officials to rise above day-to-day politics.
120 guests are gathered in the Rose Garden for the announcement.
I'm Stephen Portnoy on Capitol Hill. Senate Republicans insist they'll remain steadfast in their refusal to hold hearings to give voters the chance to weigh in. Majority Leader Mitch McConnell reportedly told a group of House Republicans last month an Obama nominee wouldn't have a snowball's chance in hell. Democrats say that level of obstructionism in the Senate is unprecedented and not what the founders had in mind.
I'm Steve Kathan in New York. To most Americans, Merrick Garland is a new name, but legal scholar Jonathan Turley says his reputation's outstanding.
Merrick Garland is the ultimate moderate choice. He writes opinions that stay fairly close to the facts of the case. He doesn't extend his decisions very far.
Garland got bipartisan support when he was confirmed to the D.C. Circuit back in